Seniors, pay very close attention right now. Your legs may be losing circulation as we speak, and you might not even feel it happening. That heaviness, that numbness, that slowing of your step, that is not simply aging, that is poor blood circulation. But what if a specific oil used in the right way, at the right time, could begin to improve your blood flow in a measurable and meaningful way, starting today? Stay with me, because what I am about to reveal may change how your legs feel from this day forward. If you are over 60 and you experience dizziness when you stand up, cold feet even when the room is warm, heavy, or aching legs by late afternoon, or nighttime cramps that wake you from sleep, stop dismissing those symptoms right now. These are not simply the cost of getting older. These are urgent signals from your blood vessels telling you that something has changed inside the arteries and veins that supply your legs. And that change needs your attention today, not next year. Today. My name is Dr. William Lee, and I have more than 10 years of clinical experience working with older adults dealing with cardiovascular and circulatory health challenges. And today, I am revealing 5 oils backed by peer-reviewed clinical research that have demonstrated the ability to improve blood flow, reduce arterial inflammation, and support vascular function in adults over 60. But here's the detail that most people never hear. When you combine 2 specific oils from this list in the morning, one dramatically improves the circulatory effect of the other, creating a vascular synergy that is proven to be more powerful than either oil used alone. I will tell you exactly which 2 oils and exactly how to combine them before this video is over. But before I get to the 5 oils, I want to ask you to do one thing right now. Type just one word in the comments below: dizziness, cold, or heaviness. Tell me which circulation symptom is affecting you the most. That single word tells me more about your vascular health than you might imagine, and I will explain why as we go through this together. Now, here is what you need to understand before we get to the 5 oils, because this biological context is what makes everything else I'm going to tell you click into place in a way that goes far beyond a simple list of recommendations. Poor circulation in the legs almost never announces itself loudly. It builds slowly, over years, sometimes decades, as inflammation accumulates inside the arterial walls, as plaque gradually narrows the channels through which blood must flow, and as the tiny, smooth muscle cells inside the walls of the blood vessels progressively lose their ability to relax and dilate on demand. When this happens, oxygen and nutrients cannot reach your leg muscles, your peripheral nerves, or the small capillaries in your feet with the speed and volume your body needs. And the result is exactly what you feel: heaviness after short walks, cold feet that no amount of socks can adequately warm, that sensation of leg fatigue in the middle of the afternoon that simply was not there 10 years ago. Nighttime cramps when the legs are at rest and blood flow decreases even further. The medical term for reduced blood flow to the legs is peripheral arterial disease, or PAD. And research consistently demonstrates that by the time a person is experiencing consistent symptoms, the underlying arterial changes have been developing for years. More than 8 million Americans over the age of 60 have some degree of peripheral arterial disease. The majority do not know it, and almost none of them have been told that specific dietary oils contain compounds that directly address the biological mechanisms causing their symptoms. That is what this video corrects. Now let us begin the countdown. I am going to go from the 5th most impactful oil to the most powerful, because I want to build your understanding in a way that prepares you fully for the combination I reveal at the end. The 5th oil is extra virgin olive oil. This is the foundation, the oil that most people already have in their kitchen, but that almost nobody uses at the right dose or in the right form for vascular health specifically. And I want to explain the biology precisely, because extra virgin olive oil is not simply a healthy fat in a generic sense. It has specific mechanisms of action on the vascular system that are directly relevant to the leg circulation problems I have described. Extra virgin olive oil contains 2 classes of compounds that act directly on the vascular system. The first is oleic acid, a monounsaturated fat that reduces the oxidation of LDL cholesterol. Oxidized LDL is the specific form of cholesterol that becomes the sticky, inflammatory material that adheres to arterial walls and begins the process of narrowing the channel through which blood must flow. Unoxidized LDL is relatively inert from an arterial standpoint. The oxidation is what initiates the damage. Oleic acid, by reducing LDL oxidation, addresses one of the primary biological drivers of arterial narrowing at its molecular root. The second and more powerful class of compounds are the polyphenols in extra virgin olive oil, specifically hydroxytyrosol and oleocanthal, which have demonstrated in clinical research the ability to increase nitric oxide production in endothelial cells. Nitric oxide is the molecule that causes your blood vessels to relax and dilate. It is the biological signal that tells the muscular walls of your arteries to open wider and allow more blood through. After the age of 60, nitric oxide production declines as the endothelial cells that produce it become less efficient, the arteries become less responsive to vasodilatory signals, blood pressure tends to rise, and circulation to the peripheral tissues, including your legs, becomes less efficient. Extra virgin olive oil, through its polyphenol content, directly stimulates the endothelial nitric oxide synthase enzyme that produces this critical molecule. The PREDIMD study, one of the largest cardiovascular nutrition studies ever conducted, involving more than 7,000 high-risk participants between the ages of 55 and 80, found that people in the highest category of extra virgin olive oil consumption had a 25% lower risk of cardiovascular events, specifically including peripheral arterial disease, compared to those in the lowest consumption category. And a separate clinical study found that consuming high polyphenol extra virgin olive oil produced significant reductions in both peripheral and central systolic blood pressure within 3 weeks, meaning blood was moving through the vessels with measurably less resistance after just 3 weeks of consistent use. The critical distinction I need to make here is between extra virgin olive oil and regular olive oil or light olive oil. Regular and light olive oils are refined, and the refining process removes the majority of the polyphenols that are responsible for the vascular benefits I just described. The oleic acid remains, but the hydroxytyrosol and oleocanthal that stimulate nitric oxide production are largely absent. If you are using refined olive oil and believing you are getting the same vascular benefit as extra virgin, you are missing the most therapeutically active components. Always extra virgin, always cold pressed, and ideally from a bottle that specifies a harvest date because polyphenol content degrades with age and light exposure. The dose that the research associates with measurable vascular benefit is 2 to 3 tablespoons per day, incorporated into meals, rather than heated to high temperatures, because excessive heat degrades the polyphenols significantly. Drizzling over cooked vegetables, incorporating into salad dressings, or adding to foods after cooking are the preparation methods that preserve the active compounds most effectively. The fourth oil is flaxseed oil, and I include flaxseed oil at this position specifically because of its unique relevance to the inflammatory component of peripheral arterial disease, which is the aspect of leg circulation problems that is most directly driven by the imbalance in fatty acid intake that characterizes the modern diet. Flaxseed oil is the richest plant-based source of alpha-linolenic acid, or ALA, the omega-3 fatty acid that serves as the precursor to the longer-chain omega-3s EPA and DHA. And the specific relevance of omega-3 fatty acids to leg circulation is this: the ratio of omega-6 to omega-3 fatty acids in the diet has a direct and powerful effect on the body's baseline inflammatory state. The optimal ratio, based on the evolutionary and clinical evidence, is approximately 4 to 1. The average person over 60 consuming a standard Western diet has a ratio of approximately 15 to 25 to 1 in favor of omega-6. This profound imbalance creates a biochemical environment in which the metabolic derivatives of omega-6 fatty acids dominate the inflammatory signaling of the vascular wall, promoting the chronic low-grade arterial inflammation that drives plaque accumulation, arterial stiffening, and the progressive narrowing of the channels that supply blood to the legs. Omega-3 fatty acids from flaxseed oil compete with omega-6 fatty acids for the same metabolic enzymes, and their metabolic products are significantly less inflammatory, often anti-inflammatory, compared to the omega-6 derivatives. By regularly incorporating flaxseed oil, you are essentially shifting the competitive balance in these enzymatic pathways toward less inflammatory outcomes, directly reducing the arterial inflammation that is one of the primary drivers of peripheral circulation problems in older adults. Beyond the anti-inflammatory mechanism, ALA from flaxseed oil has been shown in research published in atherosclerosis to reduce plasma fibrinogen levels. Fibrinogen is the protein that forms the structural basis of blood clots, and elevated fibrinogen is associated with increased blood viscosity and increased risk of clot formation in the peripheral veins and arteries. Reducing fibrinogen makes the blood less viscous and less prone to the microclotting that further impairs circulation in already compromised vessels. The critical consideration with flaxseed oil is freshness and storage. Flaxseed oil oxidizes rapidly when exposed to heat, light, or air. Rancid flaxseed oil is not only ineffective but potentially harmful, as oxidized omega-3 fatty acids produce pro-inflammatory compounds that counteract the very benefits you are seeking. Always store flaxseed oil in the refrigerator in a dark glass bottle, check the expiration date before purchasing, and never heat it. It should only be used cold, added to smoothies, yogurt, salad dressings, or drizzled over cooked foods after they have been removed from the heat. 1 to 2 tablespoons daily is the dose associated with measurable reductions in inflammatory markers in clinical studies involving older adults. The third oil is black seed oil, also known as Nigella sativa oil, and this is the one that most consistently surprises my patients when I introduce it because it is less familiar than olive oil or fish oil and yet has a clinical evidence base for vascular health that is genuinely remarkable. Black seed oil has been used medicinally for thousands of years across multiple cultures, and the modern scientific investigation of its mechanisms has validated much of its traditional use in ways that are directly relevant to the circulation problems we are discussing. The primary bioactive compound in black seed oil is thymoquinone, and thymoquinone has demonstrated in peer-reviewed clinical research multiple mechanisms of action that are directly relevant to peripheral arterial circulation. The first is its effect on blood pressure. A meta-analysis published in the Journal of Hypertension that pooled data from 11 randomized controlled trials found that black seed oil supplementation produced significant reductions in both systolic and diastolic blood pressure, with the effect being most pronounced in trials involving older adults. The mechanism is multifactorial, involving enhanced nitric oxide bioavailability, inhibition of calcium channel-dependent smooth muscle contraction in arterial walls, and direct anti-inflammatory effects on the vascular endothelium. The second mechanism is thymoquinone's effect on platelet aggregation. Excessive platelet aggregation, the tendency of blood platelets to clump together, is one of the primary contributors to the sluggish blood flow and microclotting that worsens peripheral circulation in older adults. Research published in the European Journal of Pharmacology demonstrated that thymoquinone inhibited platelet aggregation through a mechanism involving the suppression of thromboxane A2, a potent promoter of platelet clumping and vasoconstriction. This antiplatelet effect makes the blood more fluid and less prone to the sluggish, thick quality that impairs peripheral circulation, without the bleeding risk associated with pharmaceutical antiplatelet agents like aspirin or clopidogrel. The third mechanism is black seed oil's potent anti-inflammatory and antioxidant activity in the vascular wall. Thymoquinone directly inhibits the NF-κB inflammatory pathway, the same master switch of chronic inflammation that I discuss in many of my conversations about vascular health, reducing the production of the cytokines that promote arterial wall inflammation and plaque instability. A clinical trial published in the American Journal of Hypertension found that patients who consumed black seed oil daily for 2 months showed significant reductions in total cholesterol, LDL cholesterol, and markers of systemic inflammation compared to the placebo group. The recommended dose is 1 teaspoon to 1 tablespoon of cold-pressed black seed oil daily. It has a distinctive strong flavor that some people find challenging, and it can be mixed with honey, added to yogurt, or taken in capsule form if the taste is prohibitive. It should not be heated, as heat degrades the thymoquinone, and it should be introduced gradually, starting with half a teaspoon and building up over 1 to 2 weeks, as some individuals experience mild digestive adjustment during the initial period. The second oil on our list is fish oil. And while fish oil is the most widely known of the 5 I am discussing today, the specific manner in which it benefits leg circulation in older adults goes far beyond the general cardiovascular benefits that most people have heard about, and I want to explain the mechanisms with the precision that they deserve. The dose associated with vascular benefits in clinical research is 1 to 3 grams of combined EPA and DHA daily. Choosing a high-quality fish oil with a verified purity certificate is important, as lower-quality products can contain oxidized fatty acids or environmental contaminants that counteract the benefits. Enteric-coated capsules reduce the fishy aftertaste that some people find unpleasant, and if you take blood-thinning medication, discuss fish oil supplementation with your physician before starting, because the antiplatelet effect can potentiate the effect of anticoagulant drugs. And now we arrive at the first oil, the most powerful oil on this list for leg circulation in older adults, and the one that forms the dominant partner in the morning combination I have been promising you. I am talking about cold-pressed avocado oil. And I want to explain why avocado oil earns the top position on this specific list, because the combination of its mechanisms for leg circulation is more comprehensive and more directly targeted than any other oil I have discussed. Avocado oil has the highest content of oleic acid of any vegetable oil, even higher than olive oil, with approximately 70% of its fatty acid composition being oleic acid. The NO-stimulating LDL oxidation-reducing benefits of oleic acid that I described with olive oil are present in avocado oil at an even higher concentration. But what makes avocado oil unique, and what elevates it above olive oil for the specific purpose of leg circulation, is its phytosterol content and its extraordinary vitamin E content. Avocado oil is one of the richest sources of beta-sitosterol among all vegetable oils. Beta-sitosterol competes with dietary cholesterol for absorption in the intestine, directly reducing LDL cholesterol levels through a dietary mechanism that requires no pharmaceutical intervention. But more importantly, for vascular function, beta-sitosterol has been shown in research published in Circulation to reduce the expression of adhesion molecules on endothelial cells. Adhesion molecules are the proteins on the endothelial surface that allow monocytes and other inflammatory cells to attach to the arterial wall and initiate the inflammatory cascade that leads to atherosclerotic plaque formation. By reducing adhesion molecule expression, beta-sitosterol reduces the recruitment of inflammatory cells into the arterial wall, directly slowing one of the primary mechanisms of arterial plaque progression. Avocado oil also contains the highest amount of lutein of any oil from a non-animal source, and lutein has demonstrated in cardiovascular research an ability to inhibit the oxidation of LDL cholesterol with a potency that rivals vitamin E. And vitamin E itself is present in avocado oil in concentrations that are among the highest of any food-derived oil, with its primary form being alpha-tocopherol, which is the biologically most active form for vascular protection. Alpha-tocopherol is incorporated into LDL particles and protects them from oxidation directly within the lipoprotein particle, providing protection at the point where oxidative damage most directly leads to arterial wall infiltration. A randomized crossover study published in the Archives of Medical Research compared the effects of an avocado oil-enriched diet versus a carbohydrate-enriched diet in adults with high cholesterol and found that the avocado oil group showed significant improvements in HDL cholesterol, significant reductions in triglycerides, and measurable improvements in endothelial function assessed by flow-mediated dilation of the brachial artery. And another study published in the Journal of Ethnopharmacology found that avocado oil reduced blood pressure and improved the efficiency of mitochondrial function in vascular smooth muscle cells, directly supporting the ability of the arterial wall to respond to vasodilatory signals and improve blood flow to peripheral tissues. Now, I want to fulfill the promise I made at the beginning of this video about the specific morning combination that creates the vascular synergy more powerful than either oil alone. The combination is extra virgin olive oil and avocado oil consumed together in the morning, ideally with the first meal of the day. Here is why the synergy works. The hydroxytyrosol and oleocanthal polyphenols in extra virgin olive oil are fat-soluble compounds. Their absorption through the intestinal wall into the bloodstream depends on the presence of dietary fat to facilitate their incorporation into the micelles that carry fat-soluble nutrients across the intestinal epithelium. Avocado oil, with its extraordinary monounsaturated fat content, provides the optimal fat matrix for the absorption of the polyphenols from the olive oil. Studies on the co-consumption of fat-soluble polyphenols with fat sources have shown that the presence of a fat cofactor increases the bioavailability of these compounds by up to 3 to 4 times compared to consuming them without a fat partner. Conversely, the beta-sitosterol and lutein in avocado oil, both of which are fat-soluble phytonutrients, benefit from the polyphenol environment created by the olive oil, which reduces the oxidative degradation of these compounds in the gut and increases their residence time in circulation once absorbed. The two oils create a mutually beneficial absorption environment that amplifies the systemic bioavailability of the active compounds in both. The morning timing is specific for a reason. In the fasting state of the morning, the gut is cleared of competing dietary fats from the previous day, the gastric acid environment is optimal for polyphenol stability, and the post-absorptive window provides the most direct access of these compounds to the systemic circulation before the meals, and competing dietary inputs of the rest of the day create a more complex absorptive environment. Clinical studies on polyphenol pharmacokinetics consistently show higher peak plasma concentrations when polyphenol-rich foods or oils are consumed in the morning fasting or semi-fasting state compared to later in the day with larger mixed meals. The specific morning protocol I recommend to my patients is 1 tablespoon of cold-pressed avocado oil combined with 1 tablespoon of high polyphenol extra virgin olive oil consumed with a small amount of food such as a piece of whole grain bread, a handful of nuts, or stirred into a small bowl of plain yogurt. This combination provides the optimal absorption environment, the synergistic polyphenol fat matrix, and the dose of bioactive compounds that the research associates with measurable improvements in endothelial function and peripheral blood flow. Now, I want to integrate all 5 oils into a practical weekly framework because I believe that giving you specific actionable guidance is what separates useful medical information from interesting medical information that never gets implemented. Extra virgin olive oil should be your daily culinary base, 2 to 3 tablespoons per day, incorporated into all meals where a fat is used, but never heated above approximately 180 degrees Celsius to preserve the polyphenols. Use it for light sautéing on lower heat, for dressing salads, for drizzling over cooked vegetables, and as part of the morning combination I described. Avocado oil can be used for higher heat cooking when extra virgin olive oil is not appropriate, and 1 tablespoon should be part of the morning combination daily. Flaxseed oil, 1 to 2 tablespoons daily, used cold, added to smoothies, yogurt, or salad dressings, stored in the refrigerator in a dark bottle. Fish oil, 1 to 3 grams of EPA and DHA daily from a high-quality source, taken with meals containing fat to optimize absorption. And black seed oil, 1 teaspoon to 1 tablespoon daily, taken cold, with food, ideally in the morning or early afternoon. I also want to address several lifestyle factors that no amount of oil will fully compensate for if they are working against you simultaneously, because a comprehensive approach to leg circulation requires addressing the biological problem from multiple directions at once. The first is movement. The calf muscle pump, which I described as essential for venous return from the legs, requires muscular contraction to function. Every hour of prolonged sitting allows blood to pool in the veins of the lower legs, increasing venous pressure and worsening the swelling and heaviness you feel by the end of the day. 10 minutes of walking every hour, calf raises while standing, and 20 minutes of leg elevation above heart level in the evening are not optional additions to a dietary approach. They are essential components of the same strategy. The second is hydration. Dehydration thickens the blood and reduces its ability to flow through the small vessels of the peripheral circulation. Older adults have a reduced thirst sensation and are chronically mildly dehydrated without realizing it. 6 to 8 glasses of water distributed throughout the day, not concentrated in the morning with restriction in the afternoon, is a fundamental intervention for leg circulation that costs nothing and has measurable effects on blood viscosity. The third is sodium restriction. Excess dietary sodium causes fluid retention that increases venous pressure in the legs and exacerbates ankle swelling and heaviness. Many older adults consume 2 to 3 times the recommended daily sodium intake primarily through processed foods, canned soups, restaurant meals, and condiments. Reducing sodium is one of the most impactful and most achievable dietary changes for leg swelling specifically, and it amplifies the benefits of the oils I have described by reducing the venous pressure environment that impairs peripheral blood flow. I want to close by addressing something that I hear from patients regularly and that I think deserves a direct and honest response. Some people ask whether dietary oils can really make a meaningful difference to circulation that has been declining for years or decades. And my answer, based on the clinical evidence I have reviewed and the patients I have worked with over more than a decade, is yes, with important qualifications. The oils I have described today do not reverse advanced atherosclerosis or restore severely damaged vascular anatomy overnight. They work through biological mechanisms that are real and measurable, but that operate on a timescale of weeks to months to produce changes that translate into clinical improvement in symptoms. The research studies I cited that found improvements in endothelial function, blood pressure, and inflammatory markers were conducted over periods of 3 to 12 weeks of consistent daily use. Consistency is not optional, it is the mechanism. These compounds accumulate in cell membranes, shift the fatty acid composition of circulating lipoproteins, and alter the expression of inflammatory genes over time. A single dose produces a transient effect. Daily consistent use over months produces structural biological change. Patients in my practice who have implemented the morning combination protocol consistently alongside the lifestyle modifications I described have reported measurable improvements in leg heaviness, in the warmth of their feet, and in their endurance for walking, typically beginning to notice changes between 3 and 6 weeks of consistent implementation. These are not dramatic overnight transformations. They are the gradual, cumulative restoration of a biological function that has been declining gradually for years. The direction of change can be reversed. The biology responds, but it responds to consistency, not to occasional use. I am Dr. William Lee. If this video gave you something valuable today, please share it with a senior in your life who is experiencing leg heaviness, cold feet, or poor circulation. Subscribe to this channel for more evidence-based information on circulatory and cardiovascular health for older adults. And leave me a comment below with that one word I asked for at the beginning: dizziness, cold, or heaviness. Tell me what your legs are telling you. because understanding your specific symptoms is the first step toward addressing the specific biological mechanisms behind them. Your legs have been carrying you through every moment of your life. It is time to give them the circulatory support they need to keep doing that job with strength, warmth, and ease.